Symptom basically is the term used by the patient with which the patient presents to the hospital, and sign is the term used by clinician after examining the patient and finding certain clinical findings in that particular patient. So briefly, let me rephrase it in Urdu. Most of you would be familiar with the terms symptom and sign. Symptom basically एक ऐसी टर्म है जो कि पेशेंट जब हॉस्पिटल में प्रेजेंट करता है तो वो यूज़ करता है, जस्ट लाइक for example, a patient with the chronic liver disease usually presents to the hospital with the symptoms of abdominal pain, abdominal discomfort, abdominal distension, the decreased urine output, pain right hypochondrium. These are all symptoms which bring the patient to the hospital. While as far as signs are concerned, when clinician examines the patient, जब एक डॉक्टर लेट सपोज chronic liver disease के पेशेंट को एग्जामिन करेगा और उसमें उसको जो फाइंडिंग्स मिलेंगे, these are the signs. For example, the clinician depicts splenomegaly in that particular patient, it is sign. Then abdominal, then ascites, it is a clinical sign. The words. So symptoms in this chronic liver disease patient were abdominal pain, abdominal distension, abdominal discomfort, decreased urine output. These are signs, the symptoms which bring the patient to the hospital. While splenomegaly, which clinician depicts while examining the patient, and ascites, these are the signs. So another example of these symptoms and signs we can take from respiratory system. For example, a patient presents to the hospital with cough, shortness of breath. And, these are the symptoms. And when the clinician examines the patient, he may find increased respiratory rate and a bronchi on clinical examination while auscultating the chest. So these are the signs. तो पहले मैंने जो एग्जांपल दी थी वो जीआई सिस्टम गैस्ट्रोएंट्रोलॉजी सिस्टम से गैस्ट्रो इंटेस्टाइनल डिजीजेस से थी, जो कि सीएलडी का पेशेंट प्रेजेंट किया, उसमें सिम्टम्स और साइंस उस पॉइंट ऑफ व्यू से. अब जो मैंने आपको एग्जांपल दी है वो रेस्पिरेटरी सिस्टम से है, जिसमें कि एस्थमा का पेशेंट प्रेजेंट हुआ है कफ, शॉर्टनेस ऑफ ब्रेथ सिम्टम्स के साथ. एंड जब डॉक्टर ने एग्जामिन किया तो ही डिपेक्ट्स increased respiratory rate and bronchi while auscultating the chest. These are the signs. So these are the two systems. Now, if we take example from a cardiovascular system, so Patient may present with chest pain exacerbated by exertion, and pain radiates to the left arm and shoulder. These are the symptoms with which the patient presents to the hospital. So, while examining the patient, the clinician may depict increased heart rate. Any murmur may be audible in that particular patient. There may be signs of left or right heart failure, uh, as the clinician may find fine basal crepitations while auscultating the chest, or a raised JVP, as well as ascites and pedal edema, mostly up to the arms, up to the knees. These are the signs of right heart failure. So in this particular example, uh, left-sided chest pain with radiation to the left arm and shoulder. These are the symptoms with which the patient presents to the hospital, while increased heart rate, cardiac murmur, bibasal fine crepitations on chest auscultation, raised JVP, ascites, bilateral pedal edema, mostly up to the knees. These are the signs as they are depicted while clinical examination by the clinician. So these are the so far I have discussed three systems as an example of symptoms and signs. These are GI system, a CLD patient presenting with symptoms and signs, respiratory system, a patient with asthma presenting with symptoms and signs, and cardiovascular system, a patient with ischemic heart disease presenting with congestive cardiac failure. So the fourth major system we can take as an example of symptoms and signs is central nervous system. So, so patient may present with an epileptic patient may present with symptoms of jerky movements of hands and feet, and altered mental status, along with frothing in the mouth and urination during that episode of unconsciousness. So the symptoms in this case, which bring the patient to the hospital, are jerky movements of hands and feet, frothing of mouth, urination, while the patient is unconscious. These are the symptoms. So, with which the patient has presented to the hospital. No, if a neurologist or clinician examines that patient, he may clinically depict tonic-clonic fit, which is a clinical sign in this particular example, as it is clinically depicted by a neurologist or a physician. So in this particular example of central nervous system, patient with epilepsy presents with symptoms of jerky movements of hands and feet, frothing of mouth, urination while the patient is unconscious, and this is mostly told by the attendants of the patient. So these are symptoms uh, which bring the patient to the hospital. Now the clinician or neurologist examines the patient and depicts tonic-clonic fit in that particular patient, which is a clinical sign. So this is the fourth example of these symptoms and signs. I hope your concept about symptom and sign would be a bit clear, as I have quoted the definition of symptoms, signs, and I have quoted examples from four systems. GI system, in which the patient presents with symptoms and signs of chronic liver disease. Respiratory system, in which the patient presents with symptoms and signs of bronchial asthma. Cardiovascular system, in which the patient presents with symptoms and signs of ischemic heart disease. And neurological system, in which the patient presents with symptoms and signs of epilepsy. So to further enhance this concept of symptoms and signs, as we have a bit of time left, so I may quote a few other examples so that you may further clear this concept of symptoms and signs. Uh, so once again, we consider example from GI tract. A patient with peptic ulcer disease may present with pain epigastrium, burning sensation in the epigastrium that is more postprandial or after meal. So in this particular example, the symptoms which bring the patient of peptic ulcer disease to the hospital are pain epigastrium, epigastric burning, that is more after meals or postprandial. So after the patient is being examined by the clinician may depict abdominal distension, epigastric tenderness. He may encounter secretion splash in that particular patient. So the symptoms are epigastric burning, epigastric pain, that is more after meals or postprandially. These are the symptoms which bring the patient to the hospital. After examining the patient, the clinician depicts findings of epigastric tenderness, and escalation splash may be encountered. So these are the signs. So in this particular example of a patient presenting with acid peptic disease, these are the symptoms and signs. Now we consider another example from respiratory system. So a chronic smoker presents to the hospital with shortness of breath on minimal exertion and dry cough on and off. These are the symptoms. So patient after being examined by the clinician may find a bilateral reduced air entry on auscultation of this patient and occasional crepitations over right middle to lower zones. These are the signs. So in this particular example of from respiratory system, patient with the COPD presents to the hospital with shortness of breath on minimal exertion and dry cough. These are the symptoms. And after being examined by the clinician depicts findings of reduced air entry bilaterally on auscultation and occasional crepitations over right, middle to lower zones. These are the signs as they are depicted by the physician or clinician or pulmonologist. Now, once again, taking another example from cardiovascular system, a patient with valvular heart disease may present to the hospital with symptoms of severe shortness of breath on mild exertion and left-sided chest pain as well. These are the symptoms. Now, the cardiologist, after examining the patient, may depict mid-diastolic or pansystolic murmur due to valvular heart disease of mitral valve. Uh, uh, Whatever the case may be, whether the patient is having mitral valve stenosis or mitral valve regurgitation. So these are the symptoms. So the cardiologist, after examining the patient, may find out pansystolic murmur or mid-diastolic murmur, increased first heart sound, loud first heart sound, and displaced JVP. So these are the clinical signs depicted by cardiologists in this particular patient of valvular heart disease. So in this example from cardiovascular system, a patient with valvular heart disease presents to the hospital with shortness of breath on minimal exertion and left-sided chest pain. These are the symptoms. While cardiologist, while examining this particular patient, may detect pansystolic murmur or mid-diastolic murmur, loud first heart sound, and displaced JVP. And these are the signs. So last of all, let us consider another example from central nervous system. So a patient with a raised intracranial pressure may present to the hospital with the symptoms of headache, vertigo, decreased visual acuity, and a neurologist or a clinician, while examining that particular patient, may depict papilledema while performing ophthalmoscopy of this patient. So this is a clinical sign which is depicted by the clinician. So in this particular example from central nervous system, patient with raised intracranial pressure presents to the hospital with headache, vertigo, and vomiting. These are the symptoms. While neurologist or clinician, after examining this particular patient, may depict papilledema on ophthalmoscopy of this patient, which is a clinical sign. So I hope you are now quite familiar with the terms symptoms and signs. So as I have discussed a definition of symptoms and signs along with examples, two examples each from GI system. That is the patient with CLD presenting with symptoms and signs. And the other example, the patient of acid peptic disease presenting with symptoms and signs from respiratory system, patient with asthma and COPD presenting with particular symptoms and signs in cardiovascular system, patient presenting with symptoms and signs of ischemic heart disease and valvular heart disease. And the last of all, I have quoted examples from central nervous system, patient presenting with symptoms and signs of epilepsy, and the other example that I have quoted last is patient presenting with signs and symptoms of raised intracranial pressure. So I hope you will be quite familiar now with the terms symptoms and signs, and you will find it now useful while applying it clinically on the patients. And I hope you will further clear up this concept of symptoms and signs as long as you start examining patients in your third year, fourth year, or final year. And this will pretty clear up your concept further. Thank you very much.